Good afternoon, everyone. I'm Liz Lewis, the Director of Strategic Partnerships at Chicago Ideas. Thank you for joining us for this important conversation about period poverty and the injustices that make it a cyclical challenge for youth and communities of color in Chicago. I would like to make note that our speakers will be taking audience questions, which you can submit by using Ask a Question box below. Before we start, I would like to introduce Gina Patinella, the Associate Category Manager at Walgreens, to talk about the important work Walgreens is doing with You by Kotex to address period poverty. Gina, thank you for being with us today.
Thanks, Liz, and good afternoon, everyone. My name is Gina Patnella, and I'm an Associate Category Manager at Walgreens. I'm so pleased to be here today with our partners from Alliance for Period Supplies and You by Kotex. We're proud to partner with You by Kotex again with the With You She Can program at Walgreens to get additional period supplies into the hands of women that need them most. Walgreens' relationship with You by Kotex and Alliance for Period Supplies is just one of the ways the community is making a difference in the company is making a difference in the community it serves. Throughout the month of June, the purchase of any You by Kotex product at Walgreens stores or on walgreens.com will spark a donation to support even more individuals in need of help. We're honored to present a $15,000 donation to the Alliance for Period Supplies to support programming that works to address period poverty among school-aged girls. And with that, I'd like to introduce our moderator for this afternoon's conversation. She's interviewed some of the biggest celebrities from Denzel Washington to Gabrielle Union and Tyler Perry. She's the host of WCIU's The Jam and is an outspoken advocate here in Chicago, having grown up on the South Side herself. Please welcome Felicia Lawrence.
Hello, everybody. Hello, and thank you so much. I had an internal applause in my head. No, thank you so much for having me. I certainly appreciate it. This is a very important conversation. I appreciate everyone's energy surrounding this because even planning for this event, everyone just had so much energy during this time where we have so much going on in the world. There's still issues that need to be discussed and we need to move the conversation forward. So thank you so much, Gina. I am honored to foster this conversation that discusses how period poverty adversely and inequitably affects women, including youth and women of color, and how to address the cyclical problem to create long-term solutions. So in order to do that, we have assembled a powerful team of medical professionals, youth, and researchers to discuss today, because as we know, it definitely takes a community to solve a lot of these problems. And we all have our talents and gifts in the realm that we've been given, and we have to be able to use them. So let's get this show on the road. Let's bring in Kamari Stenhouse. You guys should know, as we welcome Kamari, that she graduates tomorrow. Another internal applause right there. She's graduating from Lindblom Math and Science Academy on the South Side and will be attending the University of Illinois at Champaign later this fall. And she's also an active Chicago Ideas Youth Ambassador. So everyone, please welcome Kamari Stenhouse. Kamari, thank you for being here. At first, we just have to say congratulations.
Thank you.
Yes, I'm sure you have worked so hard. So we want to send you off right. Okay. So thank you so much for being here. What an important conversation. We appreciate your time and your perspective. Let's intro our next guest today. We have Ann Siebert Coleman. She is an associate professor at St. Louis University, whose research focuses on women's health, both domestically and internationally. She recently published a study documenting the unmet menstrual hygiene needs of low-income women in the St. Louis area, and is continuing to provide more insight into these menstrual hygiene needs. Ann, thank you for being here.
Thank you so much for having me. It's really my honor. Thanks.
Yes, yes, as we've been saying, such an important conversation that we have to continue. And in order to do that, we need to welcome Dr. Erica Taylor. Dr. Erica Taylor is an experienced OBGYN at her Mercy Medical Group practice on the South Side of Chicago, who provides quality care and treatment to women from all walks of life in a very caring and respectful environment, because we know that's a part of good healthcare as well. Dr. Taylor, thank you so much for being here.
Thank you so much. It's my pleasure to be here again with you this year.
Yes, yes, it's really exciting. Let's get to it. As we said, these are important conversations. We want to be honest, we want to be real, and most importantly, we want to talk about solutions in order to get some of these issues fixed. So, Dr. Taylor, I'll start with you. We know your practice is in the Bronzeville area of Chicago, where you provide care to majority Black and Latina women from underserved areas. So, what have you actually seen firsthand when it comes to period poverty and their reproductive health?
So in regards to period poverty in the patients that I serve, I've actually had patients that come in because they have to make the choice between sometimes feeding their family or choosing to pick up their prescription medications versus like hygiene, getting hygiene products, feminine hygiene products. And so again, I don't think that should ever be an issue. If one woman is not able to get feminine hygiene products, that's one too many. And we also work with students in the high schools as well. And I see that's a very big issue. I've talked to one of the charter schools here to try to partner with them because they're actually having to go out each month prior to COVID, and they were actually purchasing products for the girls from Amazon. So again, I think this continues to be an issue. I think we need to start with some education, maybe even earlier with some of the young girls, maybe starting out at 3rd or 4th grade, just in regards to appropriate hygiene products and how they can kind of maintain appropriate hygiene during that time of the month.
Are you seeing the age for young girls getting their menstrual cycle? Is that getting earlier?
It actually is, especially in African American and Latina girls. You're actually starting a little bit earlier, seeing it sometimes as early as 8 years old.
Wow. Okay. Let's definitely get to you. You actually recently said that adequate menstrual hygiene management, that it is not a luxury. It's a basic need for all women and should be regarded as a basic woman's right. One statistic that really stands out is that 1 in 5 low-income women report missing work, school, or similar events due to a lack of access to period supplies. Based on your research, how do you feel the distribution of period products can drastically help low-income Americans, including people of color who experience equal to or higher rates of poverty?
Yes, definitely. I think that getting period products to low-income women, to women of color, is very, very important. It's important for youth and those in school. You know, looking at ways that we can do that is extremely important. So a number of schools and districts already do a pretty good job of making period products available, but making sure that that's a requirement and that schools are making those available and that students know where and that they have the education. Something that we've been seeing in our research is that a lot of the women and the students that we've been talking to are looking for additional education, right? Just around menstrual hygiene and how to manage their periods, kind of above and beyond just products, but wanting all of that. And so making sure that schools are able to provide those services, that students are linked to them, is vitally, vitally important.
Yeah, and I mean, we can bring Kamari in on this as well, but you know, I imagine not only is it up to the school to be educating students, but also parents to be educating young people in terms of what goes on with your body. I know, are you familiar? I know with sex, with having sex in school, with discussing that topic, a lot of times you have to have parents sign off on that. Is that the same for reproductive health as well? Do you know?
Um, we really don't talk about reproductive health in school. Like I know some like schools do like break it off from the sex talk. That's a whole group thing, and then some do like a separate talk for the girls and separate talk for the boys, and they talk about their own bodies. But they didn't do that in my high school. I don't think that's in CPS's curriculum. So we
Okay.
just talk about, sex, but we don't talk about reproductive health.
Okay. Let's get some more information out there, and we'll hear a little bit more about your experience, Kamari. Here in Chicago, 75% of female students in public schools, grades 7 to 12, attend Title I eligible schools, in which 40% of the student body lives below the federal poverty line. So with those numbers, those are glaring numbers right there we have on a screen for you. Can you tell us a little bit more about your experience, Kamari? Because I know we know you talk to your friends as well. Maybe you don't have to share so much of your personal experience, but just what you're seeing, because that could help us push this conversation forward. So were products readily accessible for students when they needed them?
Um, it wasn't like always like, it wasn't like Monday to Friday fully stocked. You never have to worry about it being stocked. Like most of the time the tampon machine was like empty, and like you would have to go to the nurse's office, go out of class, go to the nurse's office, wait in line and get a pad from the nurse. And I remember like one time the nurse was out of pads, and I was like texting all my contacts at school like, do you have a pad, do you have a pad, like it's emergency. And it didn't work out, so I ended up had to go home, because it's like there's nothing you can do if you don't have like, if you don't have it, you just have to go home. And like I told my mom to bring it, but it didn't work out because she was at work, so I just had to go home.
You did the next best thing. What did the nurse tell you when she was out of those sanitary napkins?
Well, she said that it was gonna be in tomorrow, or like she looked really hard.
Yeah,
so like sure. She looked really hard. Like it wasn't like, oh, I looked over and it wasn't there. She really looked, because she knew like, if like many people don't come to the nurse's office, so like if she knew somebody was coming in and asking, because we don't have a full-time nurse at my school, it was like I think twice a week, maybe 3 times.
Yeah.
So it's like if somebody's coming into the nurse's office, they actually need something, because it's rare that students do take advantage of that resource.
Yeah, that sounds like another issue for another Chicago Ideas panel right there about what you said about nurses. Do you want to jump in that, Dr. Taylor?
So I definitely feel like is definitely an issue in regards to education, because I have so many patients that come to me, high schoolers or even sometimes adults, who have not had any education, whether it be in the high school or even from their own parents. I think that for a lot of people, sex is very taboo. And so I think we need to be more open about it. Like we need to talk about our reproductive organs so that people are utilizing the proper names for them, because you'll have people that come in and they have no idea about the anatomy of their bodies. They don't know. They're like, oh, there's multiple holes down there. Which one is the baby coming from? So I think we really need to start with basics, starting with as early as elementary school, I think, and getting that education across.
And Dr. Taylor, have you seen any cultural difference with that between Black and brown women versus others?
I mean, I think you see a little bit more, I think with the, in the African-American community as well as the Latino community, I think we don't talk about it as much. I think sometimes in our communities, and not to make a blanket statement, but I think sometimes they feel like if you talk about sex, it's like you're giving your child a license to have sex. Versus like if you actually educate them, I think that we need to be more proactive in regards to keeping them protected, because they're coming in with sexually transmitted infections, they're coming in pregnant, and there's so many ways that we can prevent those things if they're with just a little bit of education.
Yeah, and what has your research shown and your experience being a woman?
Yeah, so the research that we've done in St. Louis so far and that we've published is among women. And now we're working with one of the metropolitan school districts to expand that, because the research among women really showed that they were looking for more information. They wanted more information and support, and that their recommendations were to start with the girls in the school much younger. So that's kind of the next step that we're working on right now. We've partnered with one of the school districts in the St. Louis metro area to try to look at girls who are reporting absences from school because they don't have products, looking at what type of additional education needs they have, looking at what their sources for period products are, and all of that type of stuff.
Yeah. And then let's really drive this home for people. This is about more than just an inconvenience and not going to the store or being a little embarrassed because your clothes have been soiled. It's deeper than that. Let's talk about the physical, emotional, as well as the educational consequences that students are facing by not having these products. And
yeah, so we had women who looked at us and really talked about how it affected their sense of self-worth and dignity, right? That here they are trying to take care of themselves and their families and their children, and yet they are having a hard time even caring for their own most basic needs. And that really affects your emotional and your social well-being, your self-confidence, your sense of self-worth. And it's a very basic thing that we should be able to make sure that everyone in our society has.
And that just really strikes a chord with me so much, because you are saddened because you have empathy for those women. And it also angers me, the fact that there's such the stigma around it, and that this is literally the function that brings life into this world, and we're uncomfortable with discussing it. Kamari, please weigh in on this.
Interesting that you guys were talking about starting education early. I remember I grew up around like older sisters and cousins, so like I lived with all women, so it wasn't really any taboo. So like I probably was in like seventh grade, maybe sixth grade. And it was around that time where my mom was suspecting because you know it's genetic or whatever. So she sent me to school. She was like, read this book. This is a period book. And it was like teaches you about your body and stuff. And I was reading it at school. My friend was interested and we were reading it. And I remember a teacher coming over and was like, you guys can't read that. That's inappropriate. And I was like, wow, it's inappropriate to learn about something we're about to go through. So I
Yeah.
feel like it's definitely a taboo, definitely in like middle schools and elementary schools to like talk about your body and like your reproductive health.
Yeah. What grade did you say you were in when that happened, Kamari?
I think I was in sixth grade, maybe seventh.
Okay, that's around 11, 12, 13, right in there.
Yeah.
Dr. Taylor, please.
Well, actually, when I think back to, like I went to elementary school in the South Suburbs here in Chicago. And so I remember maybe around third or fourth grade, we had a class and they actually gave us like a book and there was like I guess maybe, I don't know, maybe a beta tape at that time, but a video that we had to watch about starting your period and everybody was really excited. They gave all the girls like it's like a little purse with like a pad and some Advil. So I think we really need to go back to that, maybe having some period parties so we can do just education so it doesn't have to be such a taboo subject. And that, you know, also teaching people how to use their products properly too. I think that's something that's really key because I think a lot of people are afraid to use some of the products, such as tampons.
Yeah. Okay. Yeah, I was going to ask you you're shaking your head, and do you, is that something you've seen?
Yes, so we really heard from those that we've talked to in the research that it's beyond just kind of what is your period and why is it happening, that stuff, but the management of it, right? How to use the product, how to care for yourself, the hygiene, how to dispose of products, all of that. It seems like people are looking for, right? And that they want as part of it, and that I think we owe it. We can do better. We can do this.
Starts right here with this conversation. Let's talk about everything that's going on with coronavirus. We didn't want to have this conversation without acknowledging what's happening in our world. Dr. Taylor, how has COVID-19 affected your treatment plans and what you're doing with these patients?
So in regards to our current treatment plans, we've actually converted to telemedicine. And so we're now doing more telehealth visits with patients. Some patients are reticent about doing telehealth visits. And then we also have the issue where patients may not have access to a smartphone or may not have access to a cell phone. And so that can sometimes be a barrier to getting healthcare across to our patients. And there's still some patients who still like, I need to come in, I need to see you. And so if they feel like they need to come in, we still have them come in, but we really do try to limit the exposure. We're doing screening on every patient. So we're checking them for symptoms when they come in. Everyone that walks through the door has a temperature check done. You have to wear a mask now. And so it's really just trying to keep the patient safe as well as all the physicians. So I think that after COVID is done, I just think that telemedicine is going to be huge just in regards to the way that we deliver care. I think that we can reach more people with telehealth visits as well.
Do you like that? Can you treat patients appropriately with that?
Well, it depends on the case. So there are definitely patients that have to be seen face to face. However, in a patient who maybe, let's say, they can maybe sometimes tell you their symptoms, say they're having symptoms of, let's say, like a yeast infection. Usually there's something you can kind of triage with them over the phone and you can send a prescription over. But there are definitely things like a pregnant mom, we have to see them. Yeah. If someone has like blood pressure that's out of control or diabetes that's out of control, they may have to be seen or maybe even admitted to the hospital. So again, I think that telehealth is a good bridge for healthcare, especially when we don't have the ability to see the patients the way that we had prior to COVID.
And then also it's what we're calling a perfect storm in a sense, because we also have had the protests, which has shut down a lot of these neighborhood stores as well. When we talk about Walgreens and CVS and as well as Joel Osco, the neighborhood grocery store, I know many of them have opened back up, but even that can be a bump in the road for a lot of folks.
Absolutely. We actually had issues with access prior to COVID where patients may not have the money to actually pay a copay to get their medication. So that's been an issue. There's issues in regards to transportation. And so let's say your local Walgreens is currently inoperable. And so you may have to travel far in order to get medication. So we're also dealing with an issue where Uber may not be available or public transportation. And so again, it's creating further barriers to access. And then some of the other issues that we're dealing with in regards to COVID is that some hospitals have actually, like one hospital locally in Inglewood has decided to close their labor and delivery so that they can focus on COVID. And so again, we are starting to create these healthcare deserts within the communities that need healthcare most. And so that's an issue that we've seen with COVID. And so one of the things that they thought that they could do to kind of target this is a merger between 4 hospitals on the South Side. However, that merger will not go through because the Illinois health legislative decided that they didn't want to move forward with it. They basically needed $529 million over the next 5 years in order to make that merger happen. And so again, that will likely create a healthcare desert in these hospitals that are actually having some financial issues at this point.
Mm-hmm. Speaking of financial issues, we have to talk about unemployment as well. We know that has severely spiked given the situation. Have you had to counsel any patients surrounding that?
I have. And so we're encouraging patients to go ahead and apply for the unemployment. They have the stimulus packages out here. I've actually had some patients who say that they're actually making more money with the unemployment and with the CARES packages than they would actually make at some of their jobs. So there's definitely an issue, I think, just in regards to food insecurity. And so I think that also goes back to, like, you have to think about Maslow's hierarchy of needs. And when it comes down to, putting food on your table, maybe paying your light bill and your rent, sometimes those things will take priority over you purchasing personal hygiene items.
Yeah, especially when you're adding in a family to the mix.
Absolutely.
Trying to put food on the table for your kids. And let's bring you in on this. I want to know what your greatest concerns are regarding unemployment and some of the economic distress that our communities are under right now.
Yeah, so I mean, the combination of COVID and all the stay-at-home orders and the schools closing, I think that's something with youth that we have to pay a lot of attention to, is that schools serve as resources for students in a lot of ways beyond just the education, including providing period products. And so, we're always concerned over the summer and over winter break and that sort of thing. And now schools have been closed since mid-March. And so, kind of taking out that supply or that source of products for students at the same time when we're seeing a drastic increase in the number of families that are having economic issues, and where we're seeing increase in food insecurity. We know that there's a huge correlation between food insecurity and period poverty. And so the confluence of those things, I think, is really worrying. And how we start to bring those things back and bring those services back at even a greater level than we had before is really critical.
Mm-hmm. Well, as we analyze this issue, ladies, we certainly want to make sure that we talk about solutions. The Alliance for Period Supplies, they've been working towards that goal here in Illinois. Let's actually bring up that next slide, because I want to certainly highlight some of the good that's going on in our community. Alliance for Period Supplies Allied program actually provided menstruators with more than 40,000 worry-free days and distributed more than 260,000 period products in Illinois in 2019. Let's talk about solutions and how we as a society can create menstrual equity, which, as we know, is vital for the health and success of future generations. Kamari, please, can you tell us, what are some things, or if any ideas have popped into your head, how adults can better support kids?
Well, I don't know about the situation with COVID, but once school becomes a resource again, I think it's very important, as an administration, that they make sure that period products are always stocked, because it is an important thing. Also, I feel like that as a curriculum, that reproductive health is added so students can learn about it even at a younger age, because at high school, you probably already experienced it and you already understand what you're going through. You may not understand your body, but you already know what your menstrual is. So I feel like if we go younger, it's very intuitive that you do.
Yeah. And would there be I know you mentioned maybe some extra classes or some extra attention in the curriculum. Would there be anything else that you would change about how you learned about your reproductive health or your menstrual health?
I would make it more of an open discussion and open space. Like, I remember times where it was like, no offense to anybody, but like, I remember it was like an older lady came in to a bunch of kids and it didn't feel like very open. It was just like the students were being talked to. And sometimes the students, I know me as a student, I like to be talked with, like I like it to be an open discussion. So I don't want it to be like, oh, a whole hour lecture where we can't ask questions or we can't like ask to be reiterated or something like that, something we don't understand. So I feel like it's a step further than just teaching, it's more interaction.
Yeah, I love what you said there. Dr. Taylor, I think that happens so often where it is just, you know, all the girls go here and all the boys go there, and here's a discussion, and that could be it. That could be the extent.
Absolutely. I think it's time that we change that. I really think there used to be this show called Teen Summit. And so one of the things that I really would love to do is have something called like a sexual summit, where we sit down and we talk and we bounce issues out. And there's no question is too small. There's no such thing as a dumb question. I think that we really need to open up those lines of communication where people feel comfortable sharing, or if you need to have a one-on-one, or we need to break down into little dyads or triads and talk it out. I think that's something that's definitely needed, especially within our school systems.
Yeah, we're going to get to some viewer questions in just a moment. But Anne, do you have anything that you think could help lend itself to some solutions here?
Yeah, I mean, I tend to think about three different things. One, I think, is working with states and school systems and school districts to require free access to menstrual products in schools at all times. So like what Kamari was saying, and making sure that they're in stock. It's one thing to require them, but it's another thing to have the resources to have them in stock consistently.
Yeah, because so often I know like a lot of nurses and teachers, they end up using their own money out of their pocket to kind of fill these gaps of, you know, what we would hope our government would take care of. Please continue.
Another thing is definitely looking at the taxation issue on period products. So different states have different sales tax, and in some states the products aren't taxed, or they're taxed at the lower essential goods rate. In Missouri, they are still taxed at the highest luxury goods rate, and even just the difference between that sales tax rate and the lower food sales tax rate, if you look at it over the course of a year, so 13 cycles that a woman might have, it's the difference in tax is enough to buy a whole, 60-pack liner of liners. So that taxation, I think, makes a difference. And then also, we've seen an increase in demand at food pantries and food banks and that sort of thing, community organizations. We did find in our research, even before COVID, and even before the economic crisis that we're in, that the women that we were interviewing were relying very heavily on community organizations for donations for access to their products. So, making sure that we continue and shore up those donations and contributions like the Alliance for Period Supplies is doing.
Yeah, 1000%. Let's open it up to our viewer questions. So please let us know what you're thinking. We have one to kick us off here. The question is, how can we put pressure on government officials to have free access to menstrual hygiene products in public schools, prisons, and homeless shelters? So we just started talking about that a little bit. How can we make sure that not only is this legislation enacted, but also it's followed through on?
I think the first thing is we have to get it enacted. There are a few states and a few municipalities where they've gotten, but a lot of them have not, and talking about it. So we say it's taboo to talk about in the classroom. It's taboo to talk about it with women and girls who are the ones who are having it. To try to talk about it in a legislative body, it has proven difficult, but I think there's momentum for that. So I think we have to continue. We have to continue to advocate. We have to continue to show the research that it matters. And continue to keep it as an important issue.
Mm-hmm. And this is to everybody here. We obviously want to be inclusive in this conversation and make sure that we acknowledge all of our sisters, bringing attention to the trans as well as non-binary community who end up having periods as well. Dr. Taylor, can you speak on that a little bit?
Well, I think it's definitely an area that's sometimes overlooked, but I think that it is important that we definitely treat them as equals, like you said. So again, just making sure that products are available in those areas too, because sometimes you can have individuals who may be experiencing more homelessness or issues with job insecurity just because of their sexual orientation. So again, I think that that's important not to overlook that particular subset of our population.
Mm-hmm. 1,000%. And Kamari, I mean, please, if you would like to weigh in, please don't hesitate at all. We actually have another question. Have you seen any interest in young people and educators to use reusable products to help combat period poverty? I know we did actually discuss this a little bit last year, and there were a lot of questions surrounding this. We're not just talking about tampons and pads these days.
And there's definitely an insurgence in regards to that. So we have various menstrual cups. There's that people are actually utilizing, and so if we could get donations of things like that, that will actually take the women a lot further than, let's say, donations of pads and tampons, because they're reusable. And there's also the reusable panties too, that are on the market as well.
Mm-hmm. And then, and let's talk about a little bit more about that. I don't want to just breeze over that. You said there are reusable panties, and
Correct.
then I've seen that a lot of people talking about the Diva cup as well. So
Correct.
how do those use? How do you use those?
So the Diva cup is actually like a little insert. It's like a round little cup that you actually insert into the vagina, and it can stay in place up to 8 hours. Mm-hmm. And so you take it out, clean it, and you can replace it. Versus like with the tampons or pads, you're having to change and you're disposing of them every couple of hours. Versus like that Diva cup will go a much longer way. And they actually have some other ones on the market too. I can't think of the names of them, but there's other cups that are available as well. Mm-hmm. And then the panties that they have, they're called Thinx, Thinx, and they're just rewashable. And they come in different sizes. There's like boy shorts, there's various different cuts, bikini, boy shorts, all of that.
Yeah. Kamari, do you and your friends, do they talk about, their cycles or what they're experiencing, cramps? We have to talk about that as well. Is that an open conversation?
Yeah, definitely. We all discuss what we're going through because, it's draining emotionally and physically. And it's like sometimes like you expected to go to school every single day and like be energized. And it's like, oof, I'm going through it right now. Yeah. So we definitely talk about it. And also on the reusable product. I didn't learn about that until I was probably last year. I swim, I play water polo. So I was talking to my doctor about like other options. And then she introduced me to the Diva cup. I didn't decide to use it, but I didn't even know it was a thing. So I feel like it's very important to add that to like the education, because it's crazy that at 16, I learned that it was a thing. I thought it was only like tampons and pads as options for your period.
Mm-hmm. Yeah. Go ahead, Ann.
I was just going to say, talking about the reusable products. So in St. Louis, with the school district that we're working with, there's actually a pilot through Dignity Period, which is the reusable pad partner of the St. Louis Alliance for Period Supplies. But a number of girls signed up to try reusable pads for a number of months. And so they're getting feedback on that and stuff to see if that's an option, just to expand the options that girls have.
Mm-hmm. I'm curious to know, how do homeless women get the products that they need? I know that feminine products can be very expensive. And if we want to discuss period equity, how do we take that population into consideration? I guess Ann, Kamari, or Dr. Taylor, what have you seen with the homeless community?
Well, I would say the difference in like quality. Like, I worked with the food pantry before, and we were packing feminine bags for the women, and I use Always or like Kotex, and they're like, oh, pretty and pink and have designs on it, and they're thin or whatever. But like the ones we were giving were like plain and white and thick and bulky, and it's like, wow, like all women bodies aren't the same. So like we're giving homeless women or people who are going through a situation like the bare minimum when it comes to products. So it kind of made me a little sad for them.
Yeah, no, that's real. That's real. I mean, just given your situation, how much money you have in a bank shouldn't detail the worth of you being a human. And you should definitely be receiving equal on as far as that playing field. Please, Dr. Taylor.
So as a member of our governing body is the American Congress of Obstetricians and Gynecologists. So each year we actually do a drive where we actually will collect items for women at some of the local shelters here in the Chicagoland area. So I just think that that's one way as far as getting supplies out there. But I think that maybe the reusable ones would be something to maybe try to maybe get a partnership with some of the different companies to see if we could provide the homeless women with some reusable ones, just because sometimes it's like when they're mobile, I think it's really good to have access to something that's reusable.
Mm-hmm. Yeah. Anne?
Yeah, so we worked through a couple of homeless shelters in St. Louis and talked to a number of women, and they heavily rely on donations from the shelters and from food pantries. So like you were saying earlier about requiring that those places have products and that they make them accessible is one thing, but a lot of the women make do. They make homemade pads and tampons with toilet paper, paper towels, rags. We heard stories of cutting up their own kids' diapers to make their own pads because they got donated diapers, and then obviously they're making them last as long as they can on their kid, and then using some for themselves. And so it really is something that we need to address and that we can do much better with.
Yeah, no, thank you so much for the detail and also explaining what some women go through every day. Dr. Taylor, I imagine that can also be a health risk as well when you start inserting things into your body that shouldn't be there.
Absolutely. So again, just the education of knowing like how long you should leave it in place. There used to be an issue with some of the tampons where they used to have very, very high absorbency. So like you say, like your super plus, your ultra tampons, if you left them in place for a long period of time, women could develop this condition called toxic shock syndrome, or TSS. And so that's one of the reasons why they started going to like less absorbency with the tampons. And so again, it's a good idea like not to sleep in them overnight. Just to wear them, making sure to change them frequently, every 3 to 4 hours. The thing about the ones that are reusable, again, they're saying basically changing every 8, so taking it out. So that's one of the issues, I think, that if you're homeless, being able to maybe clean it and making sure that your hands are clean. So I think, again, we do run into some barriers. I think one issue is that maybe having them we need to maybe help them get access to homes.
Yeah.
Where they have running water. So I think that's one of the issues too that we haven't really talked about, having access to like the proper hygienic measures that we need in order to prevent that.
Yeah. In the spirit of open conversation, Doctor, please fill us in. What is, how do you know when you need to seek help? Like what is too heavy in terms of flow? And then also in terms of pain, how do you know what's normal? Because I'm sure Kamari, I'm sure you guys talk about, oh, I feel this or I feel that. And everyone, well, not everyone, but many people might be feeling the same thing, but there's different levels that you feel it at. So how do you know when you need to try to find some other kind of help?
So just in regards to heavy periods, so if you're going through, let's say you're soaking through a pad or let's say a tampon in an hour, you should go and seek help. There's a possibility that you could have fibroids, or you could maybe have an infection or something else that's going on that's causing you to have the heavy bleeding. If you ever have like dizziness, because the heavy bleeding can lead to anemia. So if you know that, let's say you're doing water polo and you're normally able to swim whatever number of meters, and now you're more fatigued with that. So if you see a difference in symptoms, like you're a runner or something, and you're now much more tired, definitely seeking out help if you're more tired, because that could be a sign of anemia. A lot of times women are out here walking around, and a normal hemoglobin for a woman is between 11 and 13. But we've had women come into the emergency room with a hemoglobin of 4, and they're sitting here talking just like you and I, and it's because like their bodies have just become accustomed and adjusted to living at that level of 4. So again, I think routine checkups are key. Seeing a doctor, once a year, even if you don't need a pap smear, but at least just checking in with a doctor at least once a year, or more frequently if you have health issues. In regards to painful periods, if it's something that's not being alleviated by something over the counter like Tylenol or ibuprofen. I had a young patient who, she was a dancer, and every time she got her period, it's like she would have to take 3-4 days off school because they were so painful. So if it's something that's affecting your day-to-day activities, then that's when you should come and seek help. And sometimes there's definitely things that we can do for that can kind of help alleviate those cramps. Sometimes putting you on a birth control pill or starting an IUD, sometimes those things can help with alleviating the pain.
Okay. And every period is different. So you might have to reassess your situation even at a later age as well.
Absolutely. And the period that you had at 17 may not be the period that you have at 35 or let's say 45.
Tell me about it, doctor. And let's talk about the stigma. So how do we reduce the stigma? I know me personally, to do that, I try to speak openly about my cycle with my husband, as well as, my brother, the men in my life. I just try to talk openly about it so they know what I'm dealing with.
Absolutely. Send them to the store to buy pads too. That really breaks the ice.
Now, let's slow down now. We got to take some steps, baby steps, because we'll come back with a whole aisle and I still won't have what I need.
You have to give them a picture. You send them a picture. Take a picture.
Yeah. Oh, that's been done.
Oh. No, so embarrassed. Just I get it all.
Yeah. No, you're 100% right. I think that certainly pushes the conversation along. What do you think, Anne?
Yeah, definitely. All the time that we can talk about it, and talk about it with people at all, with your children, with men and boys, with women, just in public settings and educational settings, just bringing it out there, reducing the stigma is so very, very important.
After all, this is what brings life into this world. It's so important. It's so natural, and men need to know about it as well. They're a part of that conversation too. Kamari, someone told me that they were trying to teach their daughter to go to the bathroom and not have to hide the fact that they are going to the bathroom. If you have your tampon in your pocket or your purse, or to have it in your hand and freely walk to the bathroom. I know that's a bold statement there, but can you think of anything that might help in this stigma?
Whoa, I'm dealing with that stigma
right?
myself. I don't know. It's like every time I go to the bathroom, whether it's public at home, I always be quiet with the wrappers and really quiet to like be discreet. So that's definitely something that I'm working on. Like my friend was like, it's a woman's restroom. Like they know what you're going through. They know what you're dealing with. They've been there. So like definitely I feel like walking to the bathroom, not being ashamed to hold it in your hand. Like I feel like that's a huge step. I will even try it because I definitely be taking a bag or something. So I think that's definitely something everybody can improve on.
1,000%. Well, I was so happy to hear what you said, Kamari, when you said that you were trying to text and call your friends. That sisterhood, I think, has gotten us so far in life, and it will continue. And we have to continue having these conversations to make sure that we're advancing the conversation. So ladies, thank you so much. Ann Coleman, we have Kamari Stenhouse, Dr. Erica Taylor, and of course, a special thanks to you by Kotex at Walgreens, and to everyone watching. Thank you so much for joining us again for this incredible conversation and this incredible panel as well. Thank you so much for having us. Let's get it back over to Liz.
Hi, everyone. Thank you so much to all of our speakers, and thank you for everyone watching and joining us. Everyone here provided really great insight into this issue. And of course, a big thank you to Felicia for moderating. Please be sure to visit allianceforperiodSupplies.org to see how you can get involved. Also, any purchase of a U by Kotex item from Walgreens during the month of June will spark a donation of up to 1.5 million products to the Alliance for Period Supplies to support individuals in need. We at Chicago Ideas are honored to be a platform for such important conversations, and we encourage all of you to keep the conversation going online at chicagoideas.com and on social media. Thank you, and have a wonderful evening. Thank you.